Hey everyone, DJ Kalicha Kid here. Thanks for tuning in to RGV Community Health Hour. Unfortunately, today, our guest that we had lined up, there was a scheduling conflict, and so we're pushing it to next week. But now I sent her a calendar invite, and now it's on her calendar as opposed to before where we were just messaging each other. So everything should be good to go for next week. Just wanted to say Happy Veterans Day to all the veterans out there. It's a day of the year where we take a moment to reflect on veterans and, all that they've done in terms of defending this nation and serving our country. And it's actually a really remarkable thing when you actually, take a deep, take some time and think deeply about it, that because we have the most powerful fighting force in the world, we're able to stay comfortable here in the States. So we're really lucky to be where we're at in terms of our geographic location, with two oceans, Canada and Mexico, kind of separating us from the rest of the world. And so again, thanks to all the veterans out there. And now we're going to just take a quick music break, and I'll be right back to hit y'all with some information. Thanks. Hey everyone, DJ Kalicha Kid here. Sorry about that. We had some technical difficulties and ended up losing power in the studio. So just wanted to say again, as a reminder for this Veterans Day, before, if you didn't catch the beginning of the episode, we've been down for quite a few minutes. Today is Veterans Day, and, being a military veteran, I know how much, how much we sacrifice, not only on the battlefield, but ongoing battles many veterans face when they come home, physical injuries, invisible wounds, and navigating the healthcare system. And with that, I'm going to take a quick music break because we're already a bit behind in terms of the episode. So stay tuned, everyone. Thanks. All right, everyone. Thanks for staying tuned in. And apologies again if you're trying to listen earlier. We had some technical difficulties. I had a brownout on the Brownsville campus. I don't know if it was the whole campus or just this building, but and sorry for that echo as well. We had a brownout, lost power, so it took a little bit of time to get everything back online. But, thanks for staying tuned. And I just wanted to take, the rest of today's episode talking about Veterans Day and Veterans Health, especially because of the Rio Grande Valley is home to over 40,000 veterans, which is one of the highest concentrations in Texas. So veteran health, especially here in the Rio Grande Valley, is community health. And so many families have multiple generations of military service. I'm sure you all probably have somebody in your family that served in one aspect or another. And so there are health issues affecting veterans in the Valley. Mental health and PTSD care gaps still exist. I've talked about it many times before on this show, where I, every 2 weeks for over the last year, I'd say like getting close to a year and a half now, have been going to what's called the Veterans Center, which is a counseling center for veterans. And so I've been going for over a year and a half straight. I think I've only missed, 2 or 3 appointments over that year and a half where I just completely forget that I have the appointment. But for the most part, I've been really committed to going and using the resource. And it's no different than here on UTRGV campus. If you're a student listening to this, I had Richard Clayton on at the beginning of the semester as my first guest to talk about all the stuff the counseling center offers and what they had planned for the semester. So if you didn't listen to that, go and tune in to that first episode because it's got a lot of great information. Another issue that we can, and that I also talk about regularly, not just for veterans, but for all of us here living in the Valley. Um, but burn pits. Burn pits exposure is mostly known for being kind of a veteran issue for many that served in Iraq or Afghanistan. But of course, not just those. Not just that theater or those theaters. You have Gulf War and Agent Orange from Vietnam, and other service-connected disabilities, which continue to impact older veterans. And access to VA resources is improving, but wait times and travel distance can still be barriers. I know that here in the Valley, because we have a large population of veterans that live here, the wait times to get an appointment at the VA can be, 3 to 6 months or more, which is kind of heartbreaking when you consider that a lot of times, these veterans, that's really the only access to medical care that they could have, in terms of it being a free service versus going out and using their, maybe private health insurance. Me personally, I mostly use the VA for mental health services, not so much physical health. I haven't had the best experience with the VA in the times that I try to get help for ailments. For the most part, I only go to the VA for a blood draw, an x-ray, an MRI, and of course my annual checkup. So, relatively simple things that the VA should be able to handle. And not that it's always handled well, but, it's one of those hoops that we have to jump through as veterans, especially disabled veterans who, need to document all the, things that may crop up after service and things like that. So I guess now we'll take another short music break. And I just wanted to apologize to any veterans out there. I wanted to play mostly rock this episode, and I played Nicki Minaj, so yeah, apologies to that for that. So it's gonna take a quick music break, and I'll be right back. Stay tuned, everyone. All right, everyone, that's more like it. That's the music we need for Veterans Day to amp our veterans up to go get all those free goodies, go get those free meals, vets, and the free coffees and everything you can get, because you all earned it and you all deserve it. So but because I forgot, due to all the chaos of the beginning of the episode and losing power and trying to get everything back online, forgot to mention my disclaimer that I mention every episode. Just a quick reminder, the views expressed on the RGV Community Health Hour are for informational purposes only and do not constitute medical advice. Be sure to consult your primary care provider for all your healthcare needs. All right, so getting back into it, we're talking about Veterans Day and our region and how it's home to one of the largest, populations of veterans in Texas. So here in the Valley, we face unique health challenges. Rates of diabetes, obesity, and heart disease are higher than both the Texas and national averages. These numbers represent real families in Brownsville, Harlingen, Farr, Hidalgo, Mission, and the surrounding communities. And behind those statistics are big factors, things like access to care, transportation barriers, food deserts, which, is another big one, and financial strain. But there's also the environmental side. If you listen to the show regularly, it's one thing that I always bring up. We live in a region where mold kind of invades everything because of our high humidity. Agricultural chemicals are used close to schools and neighborhoods. Trash burning affects air quality. Burning of all sorts affects our air quality. Flooding, which happens, when we get any kind of rain down here, some region is bound to flood. That brings bacterial contamination. And of course, like I mentioned in last episode, microplastics are basically everywhere. But being aware of these exposures doesn't mean living in fear. It means understanding the environment we live in so that we can protect our families, advocate for change, and push for better policies. That's a big one. Awareness is not a burden, it's a superpower. But this isn't a doom and gloom story. There are some really encouraging things happening here in Texas and in the Valley. UT RGV's School of Medicine continues expanding preventative health programs. Mobile clinics are reaching rural communities where medical care has been limited for too long. Nonprofits help, step up as families navigate appointments, medications, and preventative screenings. Um, and an example of that would be a guest that I've had on regularly, Elvia Gibbs, a breast cancer survivor and advocate for American Cancer Society's Cancer Action Network. She has a foundation that helps women with their breast cancer, from everything from going to getting screened to understanding, the ins and outs of everything as she has gone through it personally in terms of navigating the system and knowing which questions to ask. So nonprofits like that do a lot to help fill, the gaps where they can. But on the environmental side, more residents are testing their homes for mold, and they're testing their water. Big shout out to Joshua Moroles as well for all the stuff he puts out, and to help try to educate people in terms of knowing exactly what they're drinking and knowing exactly what's in their water through the the water district's annual reports, I guess you could put it. So of course, schools and local organizations host cleanups, recycling events, and educational campaigns. All of these steps, even small ones, matter. Switching to reusable bags, it was funny going to Boston, going to the Target in downtown and checking out, they didn't have any plastic bags. They were all the reusable bags. And, of course, they're going to charge you for the reusable bag. And I was expecting at least a quarter to, maybe more. But they were only 5 cents. So I was like pleasantly surprised, like, hey, it's a small tax to keep our environment clean and free of, single-use plastics like that. So it's just one of those things where we, try to raise awareness, try to spread the word. Lots of good people out there doing that type of work. And I always do my best here to have them on and speak about the work that they're doing to help our community. And it feels like the Rio Grande Valley has always been a place where neighbors help neighbors. You see it all the time. That can go for anywhere, but you really feel like down here, it's more tightly knit communities than a lot of other places. And when we combine community awareness with community action, we build a healthier, stronger valley for everyone. And as we continue on today's show, getting back to Veterans Day, this region has a long history of service. Many families, as I mentioned earlier, have multiple generations who've served. And for many people listening today, military service isn't distant. It's a part of family identity. Many veterans continue to face the complications I mentioned earlier, but thankfully, the VA has expanded clinics in Harlingen and McAllen to help out. But there's still a long road ahead. So today, as always, we honor not only the sacrifices made overseas, but the strength veterans show every day back home. We honor those still carrying invisible wounds. We honor the families who support them, the spouses, parents, children, and families who stand with them long after the deployment ends. To every veteran listening right now, thank you for your courage, your service, and your resilience. Thank you for defending our freedoms, and thank you for being such a vital part of the Rio Grande Valley. There's so many also great veteran organizations out there. Of course, you have VFWs and veteran support organizations out there as well. One veteran nonprofit organization that I was actively in about 10 years ago or so, when I was an undergrad at Texas A&M Kingsville. There's an organization called The Last Patrol. Really great organization. They go all over Texas to march in parades and to do various things to bring awareness to the veteran community and just to show support. They go out there and wave flags and do all kinds of great stuff. So, And as a veteran myself, like I mentioned earlier, it's one of those things where, especially this time of year, in my experiences, for my unit and the guys that I served with, um, this time of year is really rough over the last 2-3 months because we lost a lot of men overseas during our Afghanistan deployment. In 2009 to 2010, we deployed to Afghanistan as the first Stryker Brigade to the country. And it was a big transition. We were training to go to Iraq and doing everything, our entire unit was doing everything it could to get ready. And then Obama wanted more troops in Afghanistan. So they changed our orders from Iraq to Afghanistan, and it flipped a lot of things on its head. But the unit did a great job of pivoting and being ready, being operationally ready to deploy to Afghanistan and bring the fight to the enemies, which we did. And, I use that term loosely, right? Because while I was there in Afghanistan, I felt like a lot of the people that were, not to say that there weren't bad actors that were actively, obviously, right? There were bad actors who were, putting bombs on the roads and engaging in small arms fire and doing other things like that. But for the most part, I saw Afghanistan as no different than what I would think of in terms of an invading country, an invading army coming to our homeland and occupying it. So, just because someone maybe decided one day to pick up arms and fire at us, of course, it's not the right thing to do. But like I said, you put yourself in their shoes, and I'm sure there'd be many good people here wanting to do the same thing to get rid of, the invading army. So with that, I'm going to take one more music break and come back and wrap up today's episode. So stay tuned. All right, everyone. Thanks for staying tuned here for the last few minutes for today's episode. If you're tuning in late, we had some technical difficulties at the beginning, but have been powering through for about the last 30 minutes or so. So, hey, you haven't missed too much if you're tuning in now. But yeah, for these last few minutes, I just want to talk a little bit about everything going on right now with students, and in terms of, getting closer to the end of the semester. I know not too long ago, a lot of students had their midterms. And as we get closer, to the end of this month and starting next month, we get closer to finals time, which a lot of students, stress over. I'll never forget having, the finals that I've had and stressing over them, especially when I was taking, 6 classes at a time. So that's always the hard part when you want to take a big course load is, the final stretch can be the hardest stretch because, you're getting hit with all the finals for all the different classes. But yeah, so I just wanted to, say to all the students out there who are feeling burnt out, I'm right there with you. I've been working really hard for the last 3 years in this PhD program. And I have about 6 months, maybe 7 months left to wrap things up. We'll see how that all goes. But yeah, so I'm gonna work really hard. Excuse me. I'm working this weekend. Starting some experiments today, and when I start my experiments, it runs me 7 days straight. And actually, it's going to be 8 days straight because tomorrow I start another. I start the process again. So, easy 7 days can become 10 plus days. And I actually have come during these experiments for 28 days straight through weekends and everything. I also might be working next weekend. I'm not anticipating any experiments that I'm going to have to be taking care of at that time. But like I said, I'm, kind of pressed on time in terms of trying to get all my work done and, get everything ready to graduate. So, just keep, pushing on, stay strong, everyone. I know it can get tiring and frustrating, especially if you have a commute, like me, I commute from McAllen to Brownsville just about every day. And we'll hopefully be moving to Brownsville soon, so that way these last 6 months or so of me in this program, being in this program, I can spend more time getting my work done rather than commuting and dealing with all that and dealing with everything that comes with that, from having to do vehicle maintenance and whether it's oil changes and tire rotations and everything to keep my vehicle safe for the road. So yeah, it's been a grind, especially this semester. But keep it up, stay strong. You can do it. You belong. You deserve everything you work for, and then some. Because I know a lot of times we work our butts off, but still have to fight tooth and nail for every opportunity that we can get. So that's all I got for today, everyone. Like I said, just keep pushing on, and hopefully next week I should have my guest on. Everything's on the calendar and scheduled, so looking forward to having that conversation, and it gives me another week to prepare, to ask good questions and have a great show. So be sure to stay tuned next week, everyone. Because it's going to be a good one. And that's all I have. This is DJ Kalicha Kid reminding you all to stay curious, stay healthy, and let's thrive together, RGV.